This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome two guests to the program, Morrison and Lori Johnston, who are dental health educators with Grey Bruce Public Health. And today we're here to talk about Oral Health Month and all sorts of information about keeping your dental health, well, good, shiny, bright, healthy smiles, all that good sort of stuff. So welcome to both of you. And I'm wondering if you wouldn't mind just sharing how long you've been doing this at Public Health, and then we can roll into the questions that you sent me. Who wants to go first?
Sure, I'll go first. Right. Thanks for having me, Carol. My name is Morrison. I have been a dental health educator at Public Health Grey Bruce here for about 4 years, and previous to that, private practice for about 20 years. So I've had a little bit of both worlds, and hopefully today we'll be able to share some interesting information for the viewers.
Excellent. Lori.
Yes, and my name is Lori Johnston, and I've been a dental health educator here for just 2 years. And previous to that, I was also working in private practice as a chairside dental assistant for just over 30 years.
So between the two of you, lots of experience.
Yes.
So let's just jump into Oral Health Month, and it's a specific month. Was the month chosen for a specific reason?
That's a good question. April has always been Oral Health Month as long as I've remembered. So it's a national supported sort of recognition, and April is always that month. Oral Health Month is a good opportunity to remind people that the health of our teeth and gums can affect our overall health and well-being. Individuals of all ages really need to ensure they maintain good oral hygiene and do their best to prevent discomfort and disease. There's lots of oral health links and issues that can lead to other chronic diseases like respiratory diseases, diabetes, and heart disease. Oral health is more about, it's more than just cavities. It's about obviously the health of your teeth, the gums, your jaw issues, and always checking for an oral cancer screening just to be sure we've covered all the bases.
And I think that's really important because, you know, although I was smiling and saying, you know, healthy smiles, all that, but there really is health behind the appearance of a smile, right? And
that is correct.
That's what you're really pointing to. And certainly, I think, you know, it ties into the whole aspect of nutrition and, you know, taking care of all of your whole system for health. So it's important from a disease prevention perspective as well. Now, you mentioned chronic diseases, right?
Yes.
Help me understand how the connection actually happens.
So there's lots of things that can happen in our mouth, like gum disease, for instance, is directly related to diabetes and heart disease. There are many links to having like a poor oral health condition that is systemic to the rest of the body. So really, the mouth is the gateway to the rest of our body. So it's good to link those two together. It's not just, oh, I have a few teeth, they're okay. It really is the gateway to our whole bodies and our overall health.
Lori, did you have anything you wanted to add to that? I don't want you to feel left out.
No, I definitely agree with Tay. They do say that your mouth is a gateway to the health for the rest of your body. So if you're able to keep your teeth and gums healthy and free of disease, that we all want optimal health for everyone, which brings us to some of the programs that we do offer through our oral health program here at Public Health. So we do have a couple of different programs that we have available to our community members, both the seniors program and the Healthy Smiles program for children under the age of 18. So they're really important to help everyone have access to having a healthy smile, which will hopefully lead to a healthy overall sense of health as well. Yeah, thank you.
So where are the programs? And I'm wondering if you wouldn't mind now just talking more specifically about the programs, because
Sure.
it's almost like they're opposite ends of the age spectrum, right?
They are. So I will speak directly about the Ontario Seniors Dental Care Program.
Yeah.
And I'll let Tay maybe chat a little bit about the Healthy Smiles program. I work directly with our seniors program, and we do have 4 clinics located in Grey and Bruce counties. So we have Walkerton, Wyerton, Markdale, and Owen Sound. So currently in Owen Sound and Walkerton, we provide hygiene clinics, which are cleanings for children and for seniors, as well as dentistry for mostly seniors, but we can see children as well. And then our Markdale and Wyerton locations are mostly dental hygiene visits or for cleanings. So and for seniors and for children, I should add, at all 4 of the locations. So for eligibility for our seniors program, I was just going to kind of highlight a few areas so that everybody understands. It can be a little bit confusing because there are 2 programs out there, our seniors program, and there's also the federal program, the CDCP. So our program here at Public Health, for the seniors program to be eligible, you must be 65 years of age. You must be an Ontario resident. You must have a valid social insurance number, and you must have filed your income tax the year previous, because that's how the ministry goes about deciding about your eligibility, because ultimately you do have to meet a financial threshold as well. So as a single senior, your net income must be $25,000 or less, and a coupled seniors would have to have $41,500 or less to qualify for our program. And you can apply a few different ways. You can call us here at Grey Bruce Public Health and request an application be mailed to you. Our phone number is 519-376-9420 at extension 8. You could always come into the Grey Bruce Public Health Unit here in Owen Sound and pick up an application and fill it out and mail it in. Or you can also apply online. That's also another option. And I can give you that website as well if you would like. And
let's do that. Yeah.
Yeah. So that's at www.ontario.ca/seniorsdental. Okay.
Yeah.
And the program, like once you have qualified for the program, you'll receive a card in the mail, and you can call us, and we can either give you an appointment, or possibly you may be put on a waiting list until an appointment time becomes available.
Yeah.
And yeah, we cover a lot of dentistry for our seniors, which is wonderful. There's their teeth can be cleaned, regular checkups and x-rays, fillings, extractions, root canals, dentures, and in some instances, crowns as well.
So before we get to the federal program,
Yeah.
I just have some questions. So how long has this been offered through Public Health? Approximately.
I think approximately 5 years, Tay, and you might be able to.
That's correct. I think late 2019, it was sort of put into motion, Carol, but then with the pandemic, things were halted a little bit in the dental world. I mean, not just specifically at Public Health, but just everywhere. So we've been on a roll for a good few years with this Ontario Seniors Dental Care Program, and we've been really making a difference in Grey and Bruce communities for our senior clients.
And that was certainly, you read my mind. That was my next question. I was going to say, any surprises since it's been up and operational? Did it kind of meet your expectations? Pandemic aside, obviously, but did it meet your expectations? And then I'd really like to know, excuse me, who's part of the team? Like you mentioned, all these services, like who's part of the team?
For sure. I feel like the program met expectations for sure. It's a complementary program that's its only objective is to be able to help people in the community. Otherwise, without that program, so many seniors would go without any care, and they have been doing that prior to this program for a long time, too long, in fact. And so this program, it has so many advantages for seniors that qualify who otherwise wouldn't get care. And so we're pretty proud to be able to be the team that offers that here in our area.
And dentists are attached to that, and like
we do. So our Grey Bruce Public Health oral program, the team consists of dentists, hygienists, and dental health educators. We all work really closely with one another to help run these clinics that offer appointment times. We also complete school screenings and undertake health promotion type activities in the community, which is another big aspect of our role as dental providers. We have program assistant also that helps keep our team organized. Without her, this ship doesn't sail. She is amazing. She helps enter data into our tracking system, helps process invoices from our contract servicers. We have denturists that we also work with, that we have contracts with, to better service the seniors so that we are meeting sort of all of their needs as a whole.
Excellent. I've often said that the admin staff are the glue that holds everything together. So that's really helpful for me to hear. And I didn't know if you wanted to talk about the federal program next, or whether you wanted to talk about the Healthy Smiles program.
I can definitely talk about the Healthy Smiles program. I'm one of the people that's a big part of that program, so I'm pretty proud of it. Healthy Smiles Ontario has been around for quite some time, and it is a free dental program for eligible children and youth under the age of 18. The Healthy Smiles Ontario works in various streams, let's say, so it covers checkups, preventative care, and treatment. There are a few different ways that families can qualify depending on sort of the way that they qualify or the needs that they require. So it's always best to contact public health for assistance if you're not sure. In our clinics, we help enroll children into Healthy Smiles. We also do that through our school screenings. So they kind of work together to branch any gaps so that we're covering our, all the basis for Healthy Smiles.
Yeah. And again, any surprises that have come out of this program? I mean, I would think it must be extremely rewarding to be able to offer this.
It's amazing when you have, children who need treatment, and maybe, you're supporting also parents. That's another big thing. We talk about the children, but really what you're doing is supporting that child and their family through the financial measures to help them get the work that they need. You're also facilitating clinic time and also, attaching that family with a community partner to get the help that they need. So these are all really big steps to getting someone the care they need and finalized so that they feel happy and healthy and they're not in pain.
Excellent. Excellent. So the in-school screening program, how exactly does that happen?
Public Health screens all private, public, Amish, and Mennonite schools as mandated through the Ministry of Health and Long-Term Care. So depending on a risk level of a particular school, we screen grades JK, SK, 2, 4, and 7. Screenings involve a registered dental hygienist having a look inside your child's mouth for any signs of concern that might include decay or infection or any other needs that arise. the registered dental hygienist will then send home a letter or report card to the family to ensure that parents seek treatment, and to also provide information on Healthy Smiles Ontario should they need that help with that access.
Excellent.
It's pretty incredible.
Yeah, yeah. And earlier in the program, we were talking about chronic diseases, but by providing this service early, I would expect you're anticipating to make a change in that trajectory for chronic disease prevention.
Absolutely. Early childhood decay is one of the most, chronic and prevalent diseases of children. So it's important that we are getting to these school screenings. We are offering these clinic times to be able to support families and children in getting the care that they need. And I think we've noticed a big difference in it being more prevention rather than, there's always a treatment aspect, but we're getting things done early so that we can help prevent later.
Thank you. So I'm really curious about how the federal program fits in, and are there any overlaps, or how do you know which route to go?
Lori, do you want to speak to this?
I can try. So with there being two programs, I know with our senior clientele, it has been a little bit confusing, simply because they were one of the first age ranges to be rolled out. So with our seniors program that we offer here, and also with our Healthy Smiles program, some of the families and some of our seniors may apply for the Canadian Dental Program or the CDCP and be able to have coverage there, but they also have coverage through the provincial aspect of it. So not for everyone, but for some people, because again, the federal program is income dependent as well. And I believe we're coming up soon to have all of the rest of the age ranges, like between the ages of 18 and 64, eligible for the federal program, which is amazing because at this time there isn't a provincial program for that age. So it's kind of a time in a political time right now too, where I think everybody is watching and wondering where this will go. I don't have the answers for that, but I do know that in some instances, our seniors program does work alongside of the Canadian Dental Program. I know we do have several clients who can access both, and I believe the same is true for our Healthy Smiles clients as well. So the fact that we have two different types of programs is pretty amazing, and it goes to show, I think, how important our oral health is as for our overall health.
Mm-hmm.
Yeah.
You mentioned a waiting list, and that almost makes me think: is there more of a demand? How long is the waiting list?
Actually, our seniors waiting list right now, I believe it's come down very far. I believe we only have about 19 people on the waiting list. I didn't check it this morning, but I did check it last week, and it was about 19. And we do try to take clients off of there in a geographical locations. So if you live closer to the Walkerton area, you're likely going to be directed to that clinic, or if you're closer to Owen Sound, you would be directed to our Owen Sound clinic. So we are always dependent upon having adequate dentist time to serve our seniors. So I would say that our wait list can fluctuate depending on our availability. But the fact that there's only 19 on our wait list as of last week, I feel like that's pretty good. I feel pretty proud about that because there were hundreds, I believe, in the beginning. I wasn't with the program at its inception, but I believe there were hundreds of people on the wait list.
Yes, that's correct.
Yes. So happy to report that we've been able to bring that down quite a bit.
Yeah. So as you're describing it really sounds to me for seniors, for sure, and others as well, but for seniors who are confused, the best go-to is to connect with public health and ask the questions, how do I qualify? Which program do I qualify for? Because I would find it a little bit confusing.
Yeah,
For sure.
And it can be for sure. And the best thing to do is to reach out to public health if you're unsure. And again, like all of the eligibility is based on your income. So filing your income taxes is probably one of the first steps. You need to be sure that that is complete so that they can do an assessment. And so applying to our program is a perfect way to get started. If you don't qualify, then I would say definitely apply to the Canadian dental program, and go from there, and just to see where you land in it, and to know that there is help out there for so many people now with their dental care needs, and it's just a matter of applying. Just try to apply and see where you land with it.
Something to mention too, public health, like Grey Bruce Public Health, does not facilitate the Canadian dental care plan. So our program is specific to the provincial program, to the Ontario Seniors Dental Care Program, but we're always able to help provide you a phone number or connect you even on a simple Google search. If you were to type in CDCP, a senior could easily, or an adult could easily find a lot of information for that Canadian dental care plan. So we're always here to help, but our program specifically doesn't facilitate time, like in clinic time, for that Canadian dental care program. That would be private clinics and dentists in our area. If they've chosen to sign up for that program and they are willing to facilitate that program, then they would accept a senior with that specific card. So it's really easy to map out. We're definitely a wealth of knowledge, but our program strictly runs with the provincial stream.
And that's helpful to know. Public health is a navigator and helps people make the connections, but it's helpful to know where sort of the boundaries are for people in the programs. And not every dentist opts in.
That's correct. That's correct. I know quite a few of them are listed. You can even find your provider when you Google CDCP. It will give you a tab for a provider search, and it will list all of the dentists that are under and willing to accept that program in a certain kilometer radius. It gives you all the details so that you can reach out to that particular office. You can just call and make sure, hi, I'm inquiring if you take clients under Canadian Dental Care Program. I do have a card and I'm in need of care. It's really simple. I think they've really started to streamline things to make it easy for everybody that's involved.
It's excellent. As you're both speaking, what really captures me is that these programs are identified to fill the gaps for potentially lower income or income insecure individuals.
Yes.
Yeah. And I think that that's so critical as we're moving forward through the shifting sands that we're in these days. We do have some concerns for sure about seniors and their income and how far it can stretch, but also for those with families. So I think it's a program that helps to address that insecurity of income that we're facing. Many are facing these days.
Absolutely. Agreed 100%.
The other part that I know we've got about 4 more minutes in the program, so be sure to profile anything that we haven't covered. But one of the things that I wanted to go back to is the Healthy Smiles program and the impact on good dental health on learning.
That's a great point. When you have a toothache or your mouth hurts, your gums hurt, something is hurting, I know as an adult, I couldn't concentrate on anything that, a teacher was presenting or anything that someone's trying to talk to me about. Anytime you have pain, it's distracting and you're not able to eat well. Eating well helps encourage your brain power. So these are all things that are linked. If you can't eat well, you're not confident to smile, you have pain and discomfort, you're probably not learning well either. So these are all very good key points to helping children through this Healthy Smiles program. And we have a lot of teachers, staff, school facilitators that really help to work with us to get children seen, help connect parents to us. Those are all really key points in getting the children the work that they need done. So yeah, it's amazing to see.
One of the most recent things that I've learned, because we're always learning, right? Sometimes, if their fluid intake or they have medical conditions that result in dry mouth, that has an impact on dental health and gum health as well. And that was a key learn. I didn't realize that had a connection as well. So we need to emphasize the importance of hydration and things you should do, because I didn't realize that there was a connection to cavities and gum health with dry mouth.
Definitely there is. And that's one of the campaigns that has been run here at Grey Bruce Public Health is Rethink Your Drink. So one of the key components to a healthy mouth is choosing nutritious snacks. Fruits and vegetables, cheese, really good options, and then your drink as well. So water is always the best option. There's no sugar in your water. So if you can be sipping that through the day, especially if you have dry mouth, that is super important. The saliva is actually, it's like a natural cleanser for the mouth, so to speak. But when you lack the saliva, you really do need to stay hydrated with water. And not things like juice, pop, sports drinks, coffee and tea. If you're adding sugar to that and sipping it all day long, that can be super harmful to your oral health. So there's a few little things here about drinks and how much sugar is in different drinks. So water would have 0 sugar. Some juices have 5 to 6 teaspoons of sugar per serving. Pop can have 10 teaspoons per serving, a can of pop, and energy drinks or sports drinks can have 10 to 15 teaspoons of sugar per drink. So that's really high. So if you like to drink or sip on these types of drinks through the day, it's considered a continuous acid attack on the enamel. So the more if you can,
Rethink your drink.
So rethink your drink. Yes.
I can't believe our time is up. I want to thank both of you, Tay and Laurie, for being on the program today. You've shared some really important information, and do come back again, because this is really critical. I want to also thank our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care. Stay well.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Hi, I'm Lynn from Third Eye View, and welcome to a brand new season that we're looking forward to. We have some return guests and some brand new guests. And in the meantime, enjoy the rest of your summer, stay safe.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with viewers. Find out how Rogers